Hi everyone, I have a little bit of time today, so thought I'd jump on and have a bit of a chat. I just wanted to talk to you about the things that we commonly see here at the clinic in regards to all things sort of pregnancy, postpartum journey. For me personally, these types of patients are up there with my favorites. I love being able to be along the journey from even preconception all the way to postpartum, and I can be lucky enough to even treat the babies once they're born. So preconception, we see a lot of women, particularly in the pelvic health space, so people who may be experiencing things like endometriosis, PCOS, even fertility treatment. And then hopefully once they're pregnant, if they're getting any niggles, aches and pains, we are able to help them out with that too. So very typically pelvic girdle pain, pubic symphysis pain, which is pain at that front of the pelvis, hip pain, ribs, mid-back, upper back, all those things that are associated with pregnancy. We see it here at the clinic. Specifically in regards to pregnancy and birth prep, they are up there with one of my favorite appointments to do. So they can be pelvic health with an internal release, an internal assessment, but it doesn't have to have an internal assessment either. So I love these appointments because we get to really ask the questions to our patients. What are their goals? What are their goals in labor and birth? Whether that be vaginal, cesarean, inductions, spontaneous labors, really it's up to them. And we are there to guide them, answer any questions, and really just help their body get into the best possible space for them to achieve their goals. Also, why I love birth prep appointments is we start to actually get to chat about postpartum. So talking about the things that are ideal for them to do immediately after birth, and particularly in those first few weeks. In the postpartum phase, we see a lot of patients for 6 week and onwards kind of postpartum checkups, and particularly return to exercise appointments. So these really fit into that pelvic health space. The really beneficial thing about these appointments is just being able to answer all our patients' questions, any concerns that they may have. Really let them know that some of the things that they're feeling may be very common, but doesn't mean it's normal. They don't have to live with incontinence or prolapse symptoms. Really helping guide these patients in what is the best things for them to do currently, what might be things that they're a bit limited in at that point in their kind of journey. But yeah, love those kind of postpartum checkups as well. Then we do a lot of work with breast health, so mastitis, blocked ducts, engorgement, vasospasm. We see that a lot in our women postpartum. And then if we're lucky enough, we sometimes get to treat babies as well, so pediatrics. I love treating all babies, but particularly when they're those of patients that I may have seen throughout their pregnancy journey, it's just extra special, that extra special bond. There's something pretty cool about seeing a baby who you've also indirectly kind of treated while staying inside their mum's belly. Very, very special part of my job. So they're just some of the things that we see in that patient base from kind of preconception all the way to postpartum. If you've got any questions at all, please reach out to us at the clinic at Total Balance and we'd be more than happy to answer. Thanks, bye.